Hello and good evening. I hope that this video finds you well. My other video about the dialysis machine got a lot of views, so I thought I would post a video of another step in the machine process here, which is setting up the machine for treatment. Please just remember, I am not any kind of medical professional. I'm not a doctor or nurse. I'm not here to give you any kind of medical advice. I just want to kind of help people if you need to see something done or, just want to get a better idea about how the cycler here works for dialysis. Of course, this is an at-home dialysis. This is not hemodialysis. This is peritoneal dialysis. Personally, I've been doing it for 3 to 4 years now, so I'm pretty familiar with everything that goes along with that. If you have any questions, I can try my best to answer them in the comments, but obviously nothing that should be taken up with your doctor or medical professional. I'm not gonna answer anything like that. So here, like I said, I'm gonna show you how to set up the machine for a night of treatment. Now, obviously, here's my machine. Right now, it is turned off. Sorry, I'm trying to get you a better view. Okay, right now it is turned completely off. It is plugged in. This is the plug down here. Now, to get us started, I'm just going to turn it on. The on switch, it's a switch. It's to the right rear corner, and I believe it looks like your left on the screen, but it's actually my right. Because of how I have the camera, it looks backwards to you. But the switch is on the back right hand side of the machine. I'm just going to hit it, and the machine's going to turn on. There's a little light there, it beeps or blinks a couple times. So right now it says press go to start. Again, it looks backwards for you. I apologize about that, but I will tell you everything that it says. It says press go to start. I know last time I showed you how to program the cycler, which we went down and went through change program. So I'm just going to go through the program and make sure that it's the correct program, which is not a bad idea to do every night before you start your therapy. Just go through real quick. Remember, hit enter. Just going down through every one to make sure that it's correct. Then when you're done, you hit stop, and it'll tell you how many cycles and your dwell time. And we're back to the screen that says press go to start. So we're going to go ahead and press go. Now it says load the set. Load the set. You probably get these in the mail, the set for the machine. They call them cassettes. Oh, I'm sorry, it's backwards. Yeah, it's backwards. But they refer to it as a cassette or a set for short. You use a new one of these every day. So we're gonna open the bag. I just want to remind you quick before I get too much further into it, you want to make sure you wash your hands thoroughly before you start handling the cycler. Also, it's a good idea if you wear like a medical mask while you're dealing with the cycler. So these are things that they'll probably should address with you when you learn how to use a cycler, how to set it up, etc., etc. But hygiene is very, very important with this. You want everything to be sterile and clean. So that's definitely a must before you even get started. Okay, here's the cassette. First thing I'm going to do, and they're going to tell you to do this, is to close all of the clamps. So I'm just going to close them. Some of them are kind of tough and take like 2 hands, but I'm going to close all these little clamps. Just the ones that are hooked up to here. There's a clamp down here that's hooked up to the drain. I guess you could shut that as well. Let's do it. Okay, now we're going to load the set, which when it says load the set, it means this door is unlocked. So there's a little handle down here. I'm sorry, let me get a better shot of the handle there. That's a good shot. Okay. There's a little handle down here that is now unlocked, and this door can open, like so. And the machine does make noises, different kind of noises throughout the setup process. See, now it's stopped. So the door is open. It still says load the set. Now you have your cassette. This is the part that you load into the machine. It is going to line right up with the part where it needs to be loaded in at. And you just push it right in there. And you know what? I'm going to show you just a little bit of a better shot of that. See how it kind of, like it lined up exactly. There's like the shape of the cassette there. You put the cassette in. You want to make sure these tubes over here fit in between these 2 little like hatches. When you close the door, you don't want the tube to be like outside of that area. You want it to be in there so that the door will close nicely. So the door will just flip up, and then you'll push the arm down, and now the door is locked. So, okay. It says load the set still. Now I'm going to take off this blue tape, and that's going to let our cassette unwrap a little bit. Now I'm going to take the cassette and place it on this. Now this part right here is going to go through here. This little nub is going to go through here. So we're going to go over top first. You're going to kind of pull it down, and it's going to like just kind of snap right in place. So, okay, didn't really snap, but your cassette is now loaded. It is completely loaded. It's in the machine. It's on the machine. Now we're going to hit go. And now it tells you that it is self-testing. So right now it's testing itself to make sure that it can function correctly for you. So I'm going to hook up my drain line real quick, and I'll be right back. I'll explain a little bit more about the drain lines, but let me just hook this up because I never like to forget to do it. So I hooked up my drain line. You can use some different drain options, and basically you just have to really be creative with what you want to do. You could put that line into like a 5-gallon bucket. Like you'd have to tape the end like up near the top somewhere, make sure that the drain is like pointing downwards and your fluid can drain into a 5-gallon bucket. You can use some other kind of container. There's many like plastic containers out there you could use. Then like you dump out the fluid, like you could dump it into your bathtub or toilet or some kind of sink or something. I actually have a extension tube that I hook up to the drain line that then goes into a drain that my husband built that goes and drains directly into the bathtub. So I don't have to do like emptying something out every day, which is awesome because you drain out a lot of fluid over the course of your therapy, and it can be very, very heavy. So you really have to put that into consideration when thinking of your drain option, which, I mean, that's something that you could discuss with your doctor or whoever you live with, kind of brainstorm. But that's a whole nother story. Let's get back to the machine. So our drain is hooked up, our cassette is in, the machine says connect bags, open the clamps. So I'm going to open the clamps, and I have to open that other one on the drain, which if for some reason you would forget to open the clamps and you would go to the next step, the machine would alarm. It would like detect that, and it would alarm, and it would tell you like something's not right. So, there's user error, it's going to happen, and sometimes the machine is going to cover you. Now, going back to the drain, say I forgot to put my drain line into the drain that goes to the tub, okay? Or into whatever my collection option is. If you forget to hook your drain up and you start running your machine, it's gonna get fluid all over the place. So make sure that every time that you're starting your therapy, you're hitting that go button later when you're ready to start, that your drain is hooked up, because you don't want that mess. I mean, it happens. It's happened to me, and it's not the end of the world. It's not detrimental, but just save yourself the headache and, make sure that everything is set up. Okay, so we open the clamps. Now it's telling us to connect the bags. I have my bags right behind me here. I'm going to get them and put them here so you can see them. So I'm going to back this up a little bit and make a little room here. Right now I am opening the box that my bags are in. Here's a bag. Here's what the bag looks like. It's in a bag, so I'm going to take it out of its bag. I'm going to do the same with the second bag. I have two bags. I put the one up here, and I'm going to have another bag that I'm going to get right now. for demonstration purposes, I'm just going to put the second bag right here. I usually put the second bag on, there's a bottom shelf on this side and table here. So, like I said, just for demonstration purposes, I'm going to put the bag right here and set it down there so you can see it. So, didn't talk about these tubes over here much yet. And I'm sorry again for it being backwards, but the first tube on the far right, that was the drain tube, and that one was gone because we had already hooked that one up. And then you have a tube with a red clamp on it. This is the tube that you hook up to whatever bag is on the heater. This is a heater. This heats up whatever bag is on here to a comfortable temperature for your body, because this is like at a pretty cool temperature right now, probably somewhere in like 70-degree area or something like that. So that going into your body would be extremely uncomfortable. So the machine is going to heat it up so that it's not like such a shock going in your body. Like, I don't think it can hurt you, but it's definitely going to just be more comfortable heated up. So if you need help remembering, always remember red, hot, heater. That's kind of the correlation that I use. So I'm going to hook this up to the bag up here. Now, I'm going to kind of describe to you what I do before I do it. I'm going to hold this in my right hand. The other one I'm going to hold in my left hand. I'm going to use this hand to pull this off. This hand to pull the green cap off. And then I'm going to quickly connect the tubes. I'm going to do that real quick, and I'm going to explain to you why this is so important. So you're actually going to see me do it twice, once with the bag up here and once down here. So really try and watch, because you want to do this quick and you want to do it right. So, okay, it's kind of far away. You know what? Let's do it like this. Here we go. That's better. Left hand green, right hand the heater tube. It doesn't matter which one you open first. Everything needs to be just quick and smooth. And I screwed that on there. Now this right here is actually keeping this bag closed right now. This is also like a clamp, so to speak. When it says open the clamps, it's also referring to this. So you had to like break that, and now the clamp that's in there is broken, and now the fluid can go through. So I'm going to put that back in place, and I'm going to hook up the second bag so you'll be able to see this again, I think. So, try and get, now I'm going to the very next tube on the cassette, the very next tube from the last one that we picked. You go drain, heater, then for your next bag, just go with the next tube. Again, I'm going to do this very quickly. And I'm going to crack open this clamp. Let me see if, try and hear this, okay? I know you had to have heard that. There's like a little clamp in there, and now it's open, and now the fluid will come out of this bag. So I have both of my bags hooked up now. The process of hooking up the tubes is very critical, because this is a time where you're very susceptible to some kind of foreign body getting into one of these tubes or like onto the tip, and you really don't want that to happen. I'm sure you know about peritonitis. If you do not, and you're gonna be, having to go on dialysis or know somebody that's gonna be going on dialysis, look up peritonitis. Peritonitis comes from, it's an infection in your peritoneal cavity, which could happen if something gets in here that shouldn't. Some kind of like foreign matter gets in there. That's why it needs to be quick. The longer that this is not connected, the more chance there is of something infecting it. So, you want it to be quick, you want it to be swift. And now I'm lucky, my hands are not shaky or not, I'm extremely fortunate for that. So, if you're somebody that, if your hands are shaking and you're trying to hook this up, that could be potentially problematic. So, you don't want to live in constant fear that you're going to get peritonitis, but it is a real risk. It is it's something that could happen, so you want to know about it and you want to do whatever you can to prevent it. And that's also part of the reason why you wash your hands, you wear a mask, you don't want to breathe in or on this. So, you want to limit your chances of getting peritonitis as much as you can, because peritonitis is not, it's extremely difficult to treat, it's extremely painful to treat. So if you aren't familiar with it, definitely look it up. It's definitely not something that you want to deal with. Okay, so now we have opened the clamps, we have connected the bags. I'm going to hit go. And the machine's going to tell you that it's priming. I'm not sure if you can see that. It's priming. Now what it's going to do is run through its functions with the cassette, with the bags. It's going to make sure that the fluid can run through everything unimpeded. If it finds a problem, it will alarm. It will say, check patient line. The patient line, which I'm sorry that I haven't mentioned yet, but the patient line is the one that sticks up the highest on the cassette here. It's the very far left, and it'll tell you, check patient line, check heater line. That's obviously your heater line. So right now, while it's priming, you're just waiting for it to be done so you can start your therapy. Now, you can I always refer to it as doing my machine. I gotta get home, I gotta do my machine. You can do your machine in the morning. When you get up, when your machine is done, you want to break it down and set it up for the next night. That's fine. Then, at nighttime, you can go to hook up to it and it's already ready to go. Or at night when you're, soon ready to get in bed, ready to hook up to it, you can do the machine then, set it up then. It's whatever is more convenient, works for you. And, sometimes you can do it in advance, sometimes not. So it's really just very personalized. There are 2 other lines that you can hook up to bags. Other than the heater line, there's 3 lines that are just, they're normal, basic lines. They don't really do anything special. They're not really specific in any way. There is a line with a blue clamp. It's the last line, and I believe, and please remember, not an expert here at all, but I believe if I remember this from when I learned how to use a machine, that line is for a bag that during the cycle's last fill, you need a specific bag to be hooked up just for that last fill. I don't know if that makes sense. For your hopefully you're familiar with some of this terminology. My bags right here, right now, are 2.5% dextrose. That's the strength of the bag, 2.5%. Well, I do 6 cycles over the night. Say if with my last cycle, because I have fluid in me during the day, so my last cycle, there's a drain and then there's a last fill where it puts fluid in me that is in my peritoneal cavity all day. So if they would want that fluid to be stronger or like not as strong, there would be a different bag that I would hook up to that line, and then for that last fill only it would use that line. That's what I remember being told about it. Like I said, please don't quote me, but I'm pretty sure that's what that line is for. I've never had to use it, so that's another thing why I'm not so familiar with it. But I don't know if you could see, there's like fluid in the lines, the fluid's being cycled through. So I hope that some of this was informative, and I hope that I didn't ramble on too much. I'll also show you that right now my patient line, it's actually dripping a little bit because it was so full, but there's fluid all the way to the top of the patient line. So that's good. That's how it's supposed to be. Making a little bit of a mess with it, but it's just sugar water. So, but when the machine is ready, that your patient line should have fluid to the top. If it doesn't, if there's like an air pocket, like if there's like a space and the fluid doesn't start until like down here, or you could get a pocket of air in your abdomen, that is extremely, extremely painful. I've had that a couple times during, throughout the years that I've been doing this. I've gotten air pockets in my abdomen area, and honestly, it feels like you're having a heart attack. Like, apparently, air in your abdomen, the pain radiates in your shoulders. I have had pain across both shoulders, across my chest. I have gone to the ER for it. I thought I was having a heart attack. And, the air just eventually, it has to work its way out. There's not really anything that they can do about it. It's just kind of a waiting game. I know under certain circumstances they could have it surgically removed, but that would only be like if they would need to go that way, which I don't think that's very common in, cases like this. There are reasons that air would be in your abdomen that they would need to do surgery, but I don't think from this is one of them. The priming usually takes about, I want to say 5 to 10 minutes. Sometimes it takes longer. Sometimes there are issues. Sometimes it'll tell you to reload the set. Sometimes you will reload the set and it'll tell you again, reload the set. And then sometimes you just need to go get a new set. So now it says connect yourself and check patient line. That's what it's telling you. Check the patient line, make sure that there's fluid in it, which when I was showing you guys the fluid, now it went down a little bit, which that's not anything to be concerned about. And I know why it went down. Like, if you guys could see, like, some of the fluid was coming out. So, I'm running the risk that maybe I might get a little pain because of that air pocket, but it's really not that big. It's not a big deal. But that's what it's going to tell you now. Check patient line and connect yourself. So I will do another video later when I connect myself. I don't want to connect myself right now. And I mean, I could kind of show you, but then I'd have to unhook, and that would just be more time where I'd be vulnerable to some kind of infection or something. So I'm going to do another video later, and I'm going to post it very shortly after this one. Sorry about my dogs barking in the background if you can hear them. Somebody just came in the front door, and I have two little yappy dogs. So, like I said, I hope that this was informative for anybody, somebody, you know. Again, if you have any questions, I'll do my best to answer them. And look for that next video if you're interested in seeing how to hook up to the machine. I think in the next video, I'm also going to do something with heparin, and I'll explain a little bit more about that. But that's kind of a rare thing. But I will cover that in the next video also, because hooking up is going to take like all of 1 minute, and then that'll be over. So thank you so much. I hope that this was helpful, and I really appreciate you watching. See you guys next time.